It is just the biggest thing that Australia needs to do to save money. It's as simple as that. The health condition of Australians will get worse and worse as we get older and more costly than we can ever afford. If we can stop anything before it happens, it will save money, it will save lives, it will save the nation.
And what research is underway at the Florey?
The Florey is an amazing organisation of some 600 people. It's amongst the top 2 or 3 mental health research units in the world, but it costs money to keep it going. We are across some 20 different things, but principally epilepsy, number 1 in the world, stroke in the top 3 in the world, and dementia in the top 2 or 3 in the world. Other things like that. If we don't keep that going, it will simply cost the nation. Nearly 1 in 5 Australians have a mental health condition, and by the time people are in their older age, probably more than 50%. It is a tragedy. But it's a tragedy that we can improve on, that we can make difference, and we can only do that with research. Australia has been incredible with what we've done over the years, but it is costly. And we have been flatlining our research for this last 7 years. We have to make a difference, and that's why right now we're looking at what can we do. Australians are better than this. We must be better than this. And if we do it, what will happen is we will have an economy which will be better, which we can sell to the world, but we will have a better people as a result of it.
And why is the Medical Research Future Fund important?
We've been simply standing still for a period of time. And if you're standing still in anything, I can tell you this, you're going backwards. Australia is going backwards with how we are dealing with our medical research. Research is what makes the difference. Any disease that you might get, and far too many people, unfortunately, in Australia suffer from chronic disease. If we can stop it, it means we don't get it and we don't have to cure it. Curing it is sending the cost of health in this country through the roof. It is critical that we do something about it.
So prevention is an important part of medical research?
Prevention is the only thing that we are caring about. Of course, we have to worry about those that already have all of the problems, but curing what we can do into the future by simply not getting all of these diseases, the problems that we have, is the most important thing that we can do. That is why it's going to cost money, we have to do it, and it is critical that we approach this with the greatest vigour.
What impact does medical research have on the economy?
All the impact in the world. There is nothing else that we can do, because if we don't, it will double and double and double to the point where we can't afford it. It will move to the point from 4% of GDP as it once was to 9% now, to approaching 15, 16%, which is what it is in America. We can't afford it. We simply can't afford it. We have to do something about it now.